Then for bioavailability, it's basically the amount of drugs that enters the bloodstream unchanged. Now the route with the best bioavailability is IV, because there is none for absorption. The drug just enters the bloodstream directly. So IV has a bioavailability of 1 or 100%. Always add a percentage or they'll fail you. So for something like oral, it has less bioavailability because it needs to be absorbed. So the formula for that is area under the graph for the route of administration you are discussing. In this case, we're talking about oral, over area under the graph for IV administration. And that will give you an answer. If you want it in percentage, you can test it by 100. So what are the factors affecting bioavailability? First is solubility. If a drug is non-ionic, meaning it is soluble in lipid, it can easily be absorbed and as a result have a higher bioavailability. An ionic drug, which is not soluble in lipid, we have a lower bioavailability because it is less absorbed. Then we talk about instability. Some drugs are unstable in gastric acid, and as a result, we have less bioavailability. Other drugs will be broken down by enzymes. As a result, less bioavailability. So stability or instability of the drug affects its bioavailability. Then lastly, we have the first pass effect. Drug administered or absorbed through the GIT will go into the portal system and pass through the liver. And in this process, parts of these drugs are lost during the absorption. And also the liver is going to act on this drug. So the action of the liver on this drug will finally reduce to unchanged parts of these drugs. And as a result, the bioavailability of the drug will be reduced. So drug with great or high amount of or immense first pass effects will have a low bioavailability. For example, nitroglycerin has a high first pass effect and up to 90% of the drug is lost. So basically this drug is useless if not given through IV or other routes that will reduce this first pass effect.